Hi guys, welcome back to D on the Couch, and if you're new to my channel, a very warm welcome to yourselves. Please consider supporting me by subscribing to my channel. So I usually post every Sundays, but last Sunday I didn't. And this is because I was completely traumatized by the process of self-testing for COVID-19. I wasn't even able to do it myself. That unpleasant task then fell upon my daughter, Sasha. It took her about 20 minutes. Initially, she was very considerate, very understanding, because she knows that I'm very squeamish. I mean, I'm a complete coward. How I managed to birth 2 children is like beyond me. But obviously after about 20 minutes she lost her cool, understandably, because this should have only taken about 2 to 3 minutes or so. Anyway, this is not a random story because it leads me to today's video. Black people not willing to have the COVID-19 vaccine. I'm sure many of you will remember that during the first wave of the pandemic, the world was told that Black people were more likely to encounter and indeed die from COVID-19. But what the world was not told was that perhaps it had nothing to do with our genetic makeup, but rather some structural reasons. Like, for example, Black people being more than likely to live in densely populated areas, Black people being more than likely to live in intergenerational families, you know, parents, aunties, uncles, cousins, grandparents. You know, we're all about the family, right? And also that Black people were more than likely to be employed in key worker jobs, like bus drivers, delivery drivers, shops, NHS frontline workers, various roles in care homes. So what is now worrying is that the group SAGE, which stands for Scientific Advisory Group for Emergencies, say that of about 1,000 or so Black people interviewed, 72% of them said that they would not be willing to have the COVID-19 vaccine. That is a huge, huge percentage. Their refusal is not because they're being anti-vaxxers. Actually, their reasons run much deeper than that. Like historical issues of healthcare research. Perhaps the most renowned, the most infamous would be that of Dr. J. Marion Sims, sometimes also referred to as the father of gynaecology. Now, he used his position to carry out experiments on enslaved Black women, obviously without their consent. And also the issue of structural and institutional racism and discrimination. Up till now, in this century, Black people still continue to be victims of poor and neglective treatment when they encounter medical services. Death from COVID-19 is just the latest in a long line of examples. Recently, the Labour leader, Keirstarmer, reminded Parliament that Black women in the UK were more likely, 5 times more likely, to die during pregnancy than white women. So the lack of uptake of COVID vaccine in the Black community is to do with lack of trust due to past events. There are those who genuinely believe that the world is trying to get rid of them through mass vaccinations. Now, according to Winston Morgan, who is a reader in toxicology and clinical biochemistry in the University of East London, governments need to change the messaging, including not having government advisors saying that the impact of COVID-19 has nothing to do with structural racism. And also, there is a need to involve senior black historians, scientists, doctors, public health professionals. And without doing this, without involving these key black professionals, any mass vaccination program in the black community is unlikely to succeed. I, for one, will be taking up my vaccination offer when, my time comes. There is no evidence to suggest that the vaccine will work differently in black people. There is also no evidence to suggest that any side effects would be more adverse in the black community. My advice to black people would be speak to your GP. Speak to other medical professionals that you trust. Get all the information that you need, all the assurance that you need in order to enable you to make informed decisions. Okay. Also, please Google Griffith Martin. He is one of the lead doctors, lead surgeons in London, and he is working very hard to tackle COVID-19 vaccine hesitancy in the black community. Please Google him, read his statement, maybe YouTube him and listen to what he says. Please do your research, ask your questions, and make informed decisions. Until then, please stay healthy, please stay safe, and follow all the guidelines that you need to. Until then, I will see you right here on Tea on the Couch.